Pleasant good night and welcome to the news session of HealthWise by the St. Kitts Nevis Medical and Dental Association in collaboration with ZIZ Television. I am your host, Dr. Woodley-Fassale, and thank you for sharing your Monday night with us tonight. Our motto is working towards a healthier society. Hence, we use this platform to educate you, the people, as we firmly believe education allows you to make informed and wise decisions about your life, hence increasing the quality and longevity of your existence. We also use this platform to bring visibility to our doctors, our hard-working doctors whose sterling performances many times go unnoticed. This new session will be a vibrant one, and we are here to give advice on the different medical issues that we are faced with. Tonight is no exception because we have an intriguing lineup for you tonight. We come here for you, the people. Tonight, we will be dealing with postpartum depression. What is it? The symptoms, who it affects. Can you identify it before birth? In studio with me to explain to my immediate right, Mistress Warde-Crawford, clinical psychologist, and to her right, Dr. William Stones, GyneObstetrician, all the way from Nevis. This is how important we think you, our viewers and listeners, are. So we'll take a short commercial break, and when we get back, we will begin our discussion. So get yourself comfortable on your couch, get a glass of water, text your friends, let them know HealthWise is on. See you in a minute.
I'm an accountant, and you know what excites me? Precision. Just like crunching numbers accurately, National Bank's Apex Mortgage offers the lowest interest rate in the country, 3.99% guaranteed.
That was 1 minute?
Precision is essential in construction as well. Just like Apex Mortgage's attention to the detail of our dreams. If you are a college or university graduate, this is your opportunity.
Details are everything for an engineer, and Apex Mortgage recognizes this. Offering up to 40 years for repayment, it perfectly complements my home ownership needs. Plus, National has my back with a 3-month payment grace period.
Apex Mortgage for me. And me.
And me too.
National Home Loans. Home ownership made easy. When you're with National, you're home.
Okay, so if you're just joining us, good night. And this is HealthWise, and the topic tonight is postpartum depression. I have with me on my right, Sherilyn Warde-Crawford, Dr. Sherilyn Warde-Crawford, who would start the ball rolling as it relates to postpartum depression and some of its related issues as it relates to giving birth. So, Dr. Crawford, good night.
Good night.
You can give a short introduction of yourself before we actually get into the topic.
Good night. I'm Dr. Warde-Crawford. I am a clinical psychologist, and I have been involved in mental health for about 18 years.
Okay. So, Dr. Crawford, as it relates to mental concerns during the postpartum period, how does that look?
Okay, so there are several mental health concerns during the postpartum period, and some jumps out to persons because usually when you hear about postpartum, the first one that comes to mind is postpartum depression, but there are some other concerns. First, let's look at what we call the postpartum blues. Now, the postpartum blues is not a mental disorder. I want to make that clear. It is not a mental disorder. It refers to a minor mood disturbance which usually develops within 2 to 3 days after giving birth. And the symptoms tend to peak. The symptoms tend to peak around the 5th day, and the situation tends to be resolved within 2 weeks. Now, the difference with the postpartum blues is, or the baby blues, as some person call it, is that it does not have the general hopelessness that is associated with depression or worthlessness, and there's no problems in terms of, or prominent problems in terms of care for the baby, and there's no suicidal ideation. So that is the postpartum blues.
Okay, so Dr. Crawford, before you go on, what I'm noticing here based on the slides, the percentage is high, which I'm seeing 50 to 85% of new moms would tend to have postpartum blues.
Yes.
So, Dr. Stones, any somatic reasons, any body reasons, physical attributes that would cause a mom to go through these postpartum blues?
Well, Dr. Woody, that's quite an interesting question. Naturally, there are some big hormonal changes that happen immediately after the birth, and especially the loss of the pregnancy hormones, especially the progesterone, which that is kind of progesterone withdrawal. And some of the theories are around that some of the mental changes that occur or psychological aspects are to do with that. I have to say, though, obviously, as a man, my experience in these matters is a bit limited. But, I mean, having a baby is a pretty amazing thing. And I mean, it's obviously delightful and full of joy in many ways, but, you know, it's also, for many people, a huge shock. So it's not surprising, perhaps, that you know, maybe after that initial surge of adrenaline and enthusiasm, you know, all the relatives are gathering around and enthusing. And then maybe when everyone's gone home and it's quiet at night, you think, oh no, what's happened? You know, who is this person that I've got to look after? I mean, it's hardly surprising.
So it can be very overwhelming
Exactly,
at times because what I notice sometimes when you're pregnant, all the attention is on you. But once the baby comes into the picture, then everything shifts. So then that sometimes to make the mom depressed, she's no longer the center of attention. And then this can cause the postpartum blues. Why I picked it out? Because we're going to deal with the postpartum depression, which is something that is totally different. So Dr. Crawford, lead us into that, the postpartum depression.
Okay, so we are clear about the blues. Now let us look at the postpartum depression. Now the postpartum depression is a mental disorder. It is a mental disorder. So what do we look for when we're trying to diagnose postpartum depression? The first thing we want to look for is the presence of depressed mood or loss of interest or pleasure in doing things. We want to look to see if that young mother or that mother is experiencing depressed mood or loss of interest or pleasure in doing things that they used to do before and they used to find them very pleasurable. Now, if that is present, either one of these or both is present, then we go on to look for more symptoms. And we are going to look for symptoms such as problems related to appetite, And it can go from one extreme to the other. Not eating at all, or just eating everything that is in the house. We could have problems related to sleep. Same thing, from one extreme to the other. The person is not sleeping at all, or just sleeping all the time. We could have problems related to psychomotor retardation or agitation. And what that means is the person could get really agitated or slow down. So we see the extremes again. And of course, we have the usual fatigue, loss of energy, that tiredness, and then we add to that excessive guilt or worthlessness or hopelessness that is not present in the postpartum blues or the baby blues. And we're going to see symptoms like problems with concentration, or all of a sudden the person is indecisive, they have difficulty making decisions, and before time they were very good at it.
So Dr. Crawford, just to stick a pin there. So the postpartum depression, it is real. Because I know many times we don't speak about these sensitive topics. It is tabooed. And the reason why we are here tonight is to bring light to this topic. So before you continue, I would want to bring Dr. Stones again back in. Are there any indicators before birth? Because when we say postpartum, we mean after birth. So Dr. Stones, are there any indicators which you have seen in your practice that would say to you, this young lady is at risk for postpartum depression?
Absolutely. I think one of the main points about antenatal care, in other words, the care that's provided during the pregnancy, is indeed to identify risk factors for many different things. So it could be risk factors for medical problems during the pregnancy, or needs for particular interventions. But mental health is also an important part of the inquiry during the antenatal period. And those of you who've been for antenatal clinics, you might recall the nurse sitting and filling in lots of information and apparently spurious details about your life and etc. And often in a lot of health systems, there's a question, was this a planned pregnancy? And I've always wondered about that question, because I don't know how many people really have planned pregnancies. I think maybe a better language is intended or unintended. And then, of course, we have people who have an unintended pregnancy, but then actually quite quickly they're quite pleased about it, really. But then there are people who are not, and maybe the circumstances have been difficult of conception. And that, to me, is certainly a red flag. Somebody who maybe feels that this has kind of been imposed upon them, and they may really find that very difficult. And I think it's very important to identify those kind of issues about how somebody actually feels about their pregnancy quite early on, and take that into account. It's not necessarily something we can do much about in terms of, obviously, the pregnancy is there. But that may be a signal that some additional support is required, and maybe advice from other healthcare professionals.
So I'm going to put you on the spot here, Dr. Stones. Have you witnessed in your practice or have heard about somebody who would have been so depressed during pregnancy that it ended up in letting them, abort or anything like that?
Okay, I'm going to hedge and avoid the question, really, mainly because of the legal environment that we have in the Federation, that it's actually not a topic that we can discuss openly. It is a very important and significant aspect of practice, that we have to identify people's health issues and advise them appropriately. But, we have to do that within the context of the rather restrictive legal environment that we have in the Federation regarding that.
Okay, point taken. So I'm seeing some other risk factors. And before we get into the other risk factors, we have Miss Demming with us. And giving birth normally should be, a joyous experience, something momentous. It brings you a lot of joy. Before we actually, some ladies have problems in accessing this happiness after birth. So, Ms. Demming, I want you to introduce yourself, and I want you to start the process of your experience with giving birth and what took place after you gave birth.
Okay. So,
My name is Nordia Demming. I'm the communications coordinator at SCASPA, and I'm a survivor of postpartum depression. Now, I believe that my postpartum depression started during pregnancy. According to doctor, my pregnancy wasn't planned per se, but it happened at a time where my career was on the rise, and I'm a very career-driven woman. And when I found out that I was pregnant, my significant other, he provided the support for me to move forward with the pregnancy. I was surprised being young and in my career and achieving certain milestones in my life. And so when I found out I was pregnant, I was not the happiest, but I was not too sad about it. I felt that it was the time for God to bless me with a young one. However, the pregnancy journey was not an easy one, where during my pregnancy, I suffered a lot of difficulties in terms of where the child was positioned versus my health. And so from what the doctor would have explained is that he was resting on a vein, and that caused a lot of internal bleeding. I had internal bleeding during my pregnancy that caused him to arrive early. So he came when he was about 8 months, but he was very small because of my body structure. And so having to go to the doctor during those months and having to hear bad news per se, that the child is, this position or this is happening to me, it became frightening for me and my family. And they provided support where they can. But in my mind, I'm like, oh my God, I choose to go through this, and now it's affecting my health, And during, I think I had one of the roughest pregnancies. I was in labor for about 36 hours. And I didn't have the usual labor where, oh my God, my water broke, the baby's coming. I bleed once again. And I bleed, and for 36 hours I had pains, and thank God for the doctors and the nurses at Clarksville Memorial, that's in Indiana, where I was. And he did not turn. I swear I went through everything. He did not turn when he was supposed to. And so it caused almost a breach for me. And of course, all of this is playing on my mental. And then after the 36 hours when he was born, I felt distraughted. I felt this little human. Yes, I created you, but look at all what you put me through. And so I did not felt the joy and the love, like, oh my God, this is the love of my life. This is my world. I went into this mode where, okay, you're already here and I have to provide for you. So it came as if this is a job, right? And then like the following week, I noticed that I wasn't eating, I wasn't sleeping. He cried a lot, and he had a lot of, he had, because he came early, he also had difficulties as well where his liver didn't start up in time. And so, the first poo that he's supposed to pass, that didn't pass at the time. And because of what I went through during pregnancy, my milk wasn't coming down to help him. And so that itself created problems for me mentally once again. And then he had high bilirubin, and so he had to go to the doctor or the hospital every day for them to extract his blood. His eyes wasn't opening. He had jaundice very bad. It was difficult for me as a new mother. And
so I just want to bring you and Mrs. Crawford, Dr. Crawford, in tandem, because your symptoms seem so textbook. So we're going to take a break here, and we're going to come right back to delve more into the symptoms of postpartum depression. So stick and stay. See you in 1 minute.
Smart Electronics, your one-stop shop for all your electronic needs. Unlock cell phones, tablets, laptop computers, Bluetooth speakers, TVs, mobile accessories, memory cards, USB drives. We carry all major brands. Now you don't have to go anywhere anymore. Everything's available under one roof. Mort Electronics at Port Sante, opposite the food court. Telephone 466-4271. Visit our website at dutyfreesmartelectronics.com. Smart Electronics, way to live a smart life.
Meet the Johnson family, living a good life. How are they able to afford all this? By switching their mortgage to National. And you too can take advantage of this great offer. Yes, National Bank's Switch Mortgage will make your dreams a reality with the lowest interest rates guaranteed. You will have more disposable income than ever before. Imagine the possibilities. National Bank Switch Mortgage makes all the difference. Come home to National Bank and get your Switch Mortgage today. Limited time offer. Terms and conditions apply.
Okay, welcome back to HealthWise, and tonight we are discussing postpartum depression. In studio with me, I have Nordia Demming, who is a survivor of postpartum depression. To my right, I have Dr. Crawford, clinical psychologist, and I have Dr. Stones, GyneObstetrician. And we got into some sensitive areas, and I want to thank Nordia deeply and sincerely for coming on out here and putting all of this out there. I know it cannot be easy, and we are truly grateful that you took the time off tonight, because I know you are speaking to somebody out there. You are speaking to somebody who is pregnant and would have gone through a similar situation like you, or you are speaking to someone who has given birth and they have or are going through a similar situation. Sometimes mothers, we go through a lot, but sometimes, to say the truth, persons would classify you as a bad mother. So instead of saying the truth, you remain silent and you suffer in silence. So Nordia had a pregnancy that seemed to have been tough. And giving birth for most persons is a joyous thing. You lift the baby up, you're so happy, you count the toes, the fingers, you know. But for Nordia, that was different, because after birth, she went through a series of complications. And it's in tandem with what Dr. Crawford was saying, the reasons why persons would become depressed after pregnancy. So Dr. Crawford, I'm going to have you continue with the signs and symptoms which Nordia seemed to have had.
Yes.
Almost everything.
Yes. Textbook, as we say, textbook presentation. Yes, so the problems with sleep and appetite, as I said before, the tiredness, fatigue, the problems with concentration, impaired concentration, and indecisiveness. All these are symptoms of postpartum depression. And I've listed several symptoms, and the person only needs to have about 5 more in addition to the depressed mood or the loss of interest in doing things that they used to do before. Now, these symptoms that the person experienced, and I hear it from you, Nordia, is that they were clinically significant distress. So it wasn't something that was mild or barely affected you. And that is important in terms of diagnosing the postpartum depression. There must be some clinically significant distress or some impairment in the daily functioning. And what does that mean? That means the things that you used to do before, those daily activities, maybe cleaning, cooking, all these things that you found so easy to do before, you have difficulty doing these things. We want to make sure that persons know that when they have these symptoms, as psychologists and as doctors who are in the mental health field, we have to make sure that we are clear that this is depression in the postpartum period. So we will want to ask questions about substance use because we want to rule out that as a cause. We want to ask questions about medical conditions also that would rule out that as being the problem. So we can say this is major depressive disorder in the postpartum period, or as we tend to say for short, postpartum depression.
So I'm going to go back to Nordia. How were you able to rise up out of it?
Okay, so to rise up from postpartum depression, that was not easy. It was very difficult, and I saw it was difficult especially for persons that were around me. They would come, knock on my door, I would not answer. They would call my phone, I would not answer. But I had this one particular friend who was very adamant on me getting better. And so I can remember she showed up to my house, and of course I did not answer, but she knew I was there. And she sat on the veranda and she said, I'm not moving. And, she said, put on some clothes. I'm not moving. And she took me to this, it had this group. It was hosted by Dentricia Blanchett. I don't know if you know her. She's very good in terms of coaching and mental development. And she had this small group up at, I think it was Shadwell Great House. And when I went there after my friend tried it was about 2-3 hours before she can get me out the house. And then we went to Shadwell Great House, and I noticed that it was not just me. Other women were there, and I broke down.
I want to stick a pin right there because a lot of persons don't know that there is help out there.
Yes.
So this is something very important that you have just revealed to us. So I want to ask the question, does this group exist still? Because persons are listening and persons are looking.
Well, I'm not sure if it still happens, but Miss Blanchett, she still advocates for topics like these, and so you can reach out to her. Then Tricia Blanchett, I think she's found on social media. She was my first point of access of getting better. Also, Tracy's counseling by Andrea James Watley, Mrs. Watley, she helped me a lot in continuing to be where I am today. Yes.
That is very interesting. And what I liked about that friend of yours is being persistent and not giving up. And that's what we are supposed to do as friends. We are supposed to cover each other in times of difficulty, not to criticize, just go with the flow. So I want to say kudos to that friend, because sometimes, as human beings, we tend not to empathize with our friends. And somebody would have just said, you just get up, you just had a baby. You should be happy, what's going on with you? But I'm happy that your friend was mature enough to realize that my friend is having a problem. I'm going to stick it through with her, get her out the house, and get help for her. So kudos to that friend. So I want to reel back a bit because, Dr. Stones, it is important that we try to identify some of these problems before birth and look at those risk factors. Because I know one of the biggest risk factors would be ladies, young mothers under 20. That would be one of the biggest risk factors. We also have other factors. So I'm going to ask David to put back up the slide about risk factors, because I want us to look at them closely, because I think if we can identify them early, then we can actually avoid postpartum depression or manage it, identify it quicker and manage it earlier. So let me look at that slide, David, again with the risk factors for postpartum. So Dr. Stones, help us analyze all of this. Help us go through this so that persons who are looking.
Yes, thanks, Dr. Woodley. So this is There'll be a test on this at the end, will it?
No. Well, I'll be grading. I have my pen and paper here.
So we've got 3 columns. So we've got social and environmental risk factors. We've got domestic violence, previous abuse, low social support, low partner support, marital difficulties, negative life events, migration status, and low socioeconomic status. So these are a really tremendously important group of factors. And again, I mentioned this kind of screening that often goes on in an antenatal clinic. And it's actually not that easy for healthcare professionals to ask women a direct question, is your husband beating you? But having said that, actually there are ways of doing it. And it's one of the things we do learn in our specialist training, how to raise those kind of topics in a or in an appropriate way. We may or may not get a straight answer, but often people actually are looking for an opportunity to disclose, for example, spousal abuse, or maybe a history of previous child sexual abuse or whatever, which is really colouring their perceptions of the current pregnancy. So I think the important practical point for us as healthcare professionals is to make it easy for people to disclose those kind of factors. So then, clearly, there are things that we can assist with in that regard, and then there are things that we can't assist with. So we can't solve everybody's life issues, but there are merely the fact of being able to disclose and then perhaps be channeled into some form of support service can be very, very useful. I think the presence of migration status on this list is particularly important for us in the region, in the current environment where we are seeing an awful lot of global migration going on. And as we know, we do have persons in need arriving from places like Haiti, and some of them are pregnant, as we have seen. And that can be a particularly difficult scenario, that you're in a strange land, it's different language, different culture, and you're pregnant, and that is tremendously difficult. So I think persons who have sought refuge or have migrated in search of assistance, we need to be particularly careful with them in the context of pregnancy. So then we've got our next column of psychological risk factors, so depression, anxiety, history of depression, substance use, family history of psychiatric illness. Again, I mean, depression, anxiety are very, very common in the general population, as I'm sure Dr. Crawford would concur. These are not rare conditions, and it's just not surprising that among any group of pregnant persons, some of them will have had possibly quite significant depression or anxiety in the past. Or may indeed already, be suffering from depression, may perhaps be on medication or not. And in fact, one of the multiplier problems is often that women may be very concerned about the safety of the medication that they might be on for depression. And often we find ourselves having to reassure people, because in fact, most of the commonly used antidepressants are actually very safe for use in pregnancy. It's important that we know about them. But it's not that there are a few which need to be avoided in pregnancy, but in general, as a group of drugs, they're generally safe. And it's often a question of finding out exactly what somebody needs, and do they still need that medication, or do they still need that dose, or whatever it is, but providing reassurance. So then substance abuse, this is another one where it can be difficult to get a straight answer. But again, my experience, at least in Nevis, I don't know whether it applies in St. Kitts. I mean, I do ask people directly what they might be using, and they quite often do tell me. I mean, usually it's weed. But as I'm aware, especially among the younger population, when people say weed, they say weed and local herbs, and then I start to inquire about the local herbs, and actually some of those are actually quite serious, highly dangerous drugs, which are being mixed in with the perhaps more benign weed. So I think those kind of inquiries are things that we need to do, although they can be quite awkward conversations sometimes. But we need to ask. And again, sometimes, generally, I don't know whether people are not telling me, should tell me, but in general, people seem to be, in the context of a confidential clinical consultation, if we give people the opportunity to disclose substance use, then I think generally people will do that.
Okay. All right, so we're going to take a short break once again. So stick and stay, and see you in a minute.
your dream home.
I'm an accountant, and you know what excites me? Precision. Just like crunching numbers accurately, National Bank's Apex Mortgage offers the lowest interest rate in the country, 3.99% guaranteed. Precision is essential in construction as well. Just like Apex Mortgage's attention to the detail of our dreams. If you are a college or university graduate, this is your opportunity.
Details are everything for an engineer, and Apex Mortgage recognizes this. Offering up to 40 years for repayment, it perfectly complements my home ownership needs. Plus, National has my back with a 3-month payment grace period.
Apex Mortgage for me and me.
And me too.
Get your dream home.
National Home Loans. Home ownership made easy. When you're with National, you're home.
Smart Electronics, your one-stop shop for all your electronic needs. Unlock cell phones, tablets, laptop computers, Bluetooth speakers, TVs, mobile accessories, memory cards, USB drives. We carry all major brands. Now you don't have to go anywhere anymore. Everything's available under one roof. Smart Electronics at Port Sante opposite the food court. Telephone 466-4271. Visit our website at dutyfreesmartelectronics.com. Smart Electronics, way to live a smart life.
We never know when a storm may strike, but we can be prepared. At Scalec, we work tirelessly to keep our customers connected. When a storm is approaching, we activate our hurricane preparedness and response plan. We monitor the storm and work closely with the authorities. We'll need you to ensure that there are no trees in the lines near you. If you need our help, call us for more information. It is likely that there will be a power outage, so make sure all your devices are fully charged. If you have a generator, make sure the changeover switch works. Ensure you have enough fuel and that your generator is isolated from the grid. It's best that you power off your main switch from the electrical panel and unplug all appliances. When calling to report faults, tell us everything. Don't leave any information out. After the storm, our response teams will assess the damage to our network. Be sure not to worry. Scalec is right here with you when you need us most.
Okay, so welcome back to HealthWise, and we are dealing with postpartum depression. Too many of our mothers are suffering in silence because we don't have conversations of empathy, we don't have conversations of concern. We more are interested in criticizing. So postpartum depression, it is real. This condition is real. And so far, we have looked at the definition, signs and symptoms, and we had Miss Nordia Demming, who was so articulate with the symptoms that she endured before and after pregnancy. We are also here with Dr. Crawford, clinical psychologist, who gave the psychiatric and psychological components of postpartum depression. And we also have with us Dr. Stones, GyneObstetrician, who deals with the lady before giving birth, but in this period, sometimes we can identify risk factors which we have gone through. To my left, I have another special guest, and this is in the form of Nurse Fredrick, Nicole Fredrick. She's a nurse, well, colorful nurse, works well. I've worked with her, and she's here as a nurse to give symptoms because she would have worked with persons who would have suffered from postpartum depression. Nurse Fredrick, good night, and thank you for being here with us.
Good night to everyone. Dr. Woodley, thank you for the introduction. As everyone already know, my name is Nicole Fredrick, and I have been a nurse for about 2 decades. I want to speak about postpartum depression, not just from the nursing aspect. I was privileged enough to see both from the nursing aspect and, as a patient myself. I became a part of the statistics where I was a teenage mother. I got pregnant at the age of 17 years old. And it was very difficult for me because I did not have the family support that I expected. And to add, what's the saying that they say?
Insult to injury.
To add insult to injury, my mother and I did not have the best relationship, and so we spoke about predisposing factors, and basically I was already depressed before even getting pregnant. I was going through so much, and then finding out I was pregnant, it complicated the matter. I got really depressed, and it was either or. I was either at the left side of the scale or the right side. I was either really sad, withdrawn, etc., or I was either really angry at everybody and everything. And it was very difficult for me to cope having the pregnancy, going through the pregnancy and having the baby. It was difficult. I did not have the support. I did not want to take care of the baby. I wasn't happy even having the baby. In fact, I was ashamed. And at one point I felt like, committing suicide. So that was really tough for me. But luckily enough, I had, just like the previous guest, I had, the support of a close friend who encouraged me. And I also wanted to start nursing because I wasn't a nurse then, but I joined the nursing program 3 months. My son was just 3 months. By then I was, somewhat over the depression. He was just 3 months. I joined the nursing program, and going into nursing, I was able to see exactly, because I didn't know that I was depressed. In our society, people say, oh, come out of that, man, just get up, go out of the house, go somewhere, leave the child with somebody, go and have a good time and come back. But I didn't have that. I had my mother, I had my father, but I didn't have the support. In fact, I could remember being on the unit where there was this particular nurse, God bless her soul. She came and she encouraged me because my mom came to visit someone and she didn't visit me. That even complicated the matter more. I was so heartbroken, but in the end, I overcame, but it was not easy. It was difficult. All the signs and the symptoms I had, including to the point where I almost committed suicide. I didn't care. I didn't care whether I was going to die. I didn't care about the child. And I tried to hide it from my partner. Even though we were together, I tried to hide it. It's like, it was so much. I'm asking myself, how am I going to get through life? I don't have a job. I just completed school. I can't even cook. I didn't even tell the guy that I couldn't cook. So it was very difficult. And it was a tragedy. And I really do hope that we highlight support groups because it is absolutely necessary.
Nicole, thank you so much. You gave me some, goose pimples there. Because sometimes we see people and we don't understand what they're going through. And sometimes, as I say, we are just so quick as a society, our culture, we really do lack that empathy. But what I must highlight though, for both of you, they were friends. And I want people to realize the importance of being a friend. It's not just to go out and have a good time and drink.
Yes.
I mean, it's almost like a marriage, the good and the bad, the ups and the downs. And we cannot let down each other. Whatever little disturbances you may have with your friends, okay, that's okay. We're all human beings. That is going to happen. But I want to kudos those friends of yours who stood with you during such a tough time, because Nicole and Dr. Crawford helped me dissect this. Nicole had some really serious symptoms.
Yes.
And that's one of the complications I would have read about postpartum in terms of hurting yourself and the newborn. So delve into that for me, Dr. Crawford.
Yes, so I'm really happy that you mentioned the symptom of suicidal thoughts, because I'm not sure if that came out when we spoke earlier. But having thoughts of death, just what would it be like if I die, or I just want to go, just leave the earth and don't come back, or serious suicidal thoughts, or sometimes there might not even be a plan, but you just feel like you want to die and there's no specific plan. So that's another symptom of major depressive disorder or postpartum depression. And yes, because when we are depressed, or when persons are depressed, they don't even want to care for themselves. No. Never mind caring for the baby. Okay? And we have to be careful too, because we have what we call postpartum psychosis also. That is very important, and that's when the person develops psychosis during the postpartum period, and they would have even more severe symptoms where they are unable to care for their children because they have hallucinations, they might have delusions, their thoughts might be so disorganized that they cannot do things for themselves and care for themselves. Okay, so that's postpartum depression, something we have to make sure we assess whenever we are dealing with persons who have conditions during the postpartum period. We want to make sure, is this the baby blues? Is this postpartum depression? Is this postpartum psychosis? But as you so clearly said before, sometimes you're so depressed that you don't want to care for the baby, you don't want to care for yourself, you cannot care for yourself, and you think about harming the baby, think about harming yourself also.
And from the nursing aspect, I just want to mention that as nurses, we have to be so vigilant, whether you're working on the hospital unit or in the health center setting, because you are the one who has close relations with the patient, and so you're able to identify those early signs and symptoms very quickly and notify both the doctor and the patient's relative if they have a support system.
Yes, that's continuity of care.
Yes.
When you're able to follow that pregnant mother through in the pregnancy, you're able to kind of learn that pregnant mother, and then after the pregnancy you continue the care. You're able to pick up even quicker when the person is changing.
Yes.
Okay, so what I'm gathering here, that being pregnant and screening for postpartum depression is an important tool that we should do to our pregnant ladies. Dr. Stones, I don't know if you want to shed some light in terms of screening, if you do any of that.
I wouldn't mind doing that, but I'd like to just chip in with another angle, if I may,
sure.
Which it's kind of risk factor, but it's also something that is very much down to us. And I just want to put the spotlight onto the health system a little bit, because, we've highlighted the fact that having a bad pregnancy is a risk factor, surprise, surprise, for postnatal depression, or having a difficult delivery is definitely a risk factor. And that's not exactly surprising. But I have to say, one of the things that we sometimes do as healthcare professionals is make things worse by a not very nice experience of pregnancy and childbirth.
That's true.
And I think that is an aspect of maternity care which is getting more and more importance is being given to that aspect, if you like, the experience of care. Yes, you can have technically correct maternity care, you can have your blood pressure measured and treated, you can have your baby breech diagnosed or whatever it is, but what is the experience of the woman and her family during the pregnancy and during the birth? And that to me is a huge challenge for us in the health system, because it's down to us. What experience do we offer, or do we provide to women and their families? And that is something we can do things about. It doesn't cost money. A lot of it is just attitude and being considerate and listening to women. So much of the research literature highlights the issue of women not being listened to. And those of you follow what goes on in the UK at the moment, there's a huge series of maternity unit scandals going on in the United Kingdom, and a lot of it boils down to women not being listened to. And I have to say that is not something which is completely alien to our federation and health system, that we do sometimes find that as healthcare professionals we don't listen to women sufficiently, and we don't go to the trouble of making sure that the services that we provide are services that women actually want. and feel comfortable with. And again, remember that business about a young teenage mother, does she feel comfortable with us? A migrant lady, does she feel comfortable? Do we speak Spanish? No, I don't. Or are we able to accommodate to other cultural norms, etc.? And even simple things like, are we allowing a companion in the delivery room to assist with the delivery? And in Nevis, in the maternity unit at the Alexandra Hospital, there's a lot of progress been made in the time that I've been there, working there for the last 3 years, trying to make things more woman-friendly. But I know that we've all got a long way to go in that regard. And I actually find it very useful when mothers who've given birth actually share their experiences and tell us what it was like. Please tell us. Because I'm sorry, I'm having a bit of a rant here, but it's a topic which I do feel very strongly about, that there are things that, there's biology that we can't necessarily do anything about. There's people's difficult previous life experiences. We can't necessarily do much about that, but we can help with the way that we provide services and make sure that women have a good pregnancy and birth experience, even if they have medical complications. That doesn't mean that they can't have that care and that feeling of being looked after and cared for, which is so important.
Thank you so much, Dr. Stones. We truly appreciate that. We're going to take a break, and we are going to come shortly right back.
Dr. Khalil Cannonier graduated from the Latin American School of Medicine, Havana, Cuba in 2019. Since graduating, he has worked as an emergency room physician. As the district medical officer for the region of Sandy Point to Palmetto Point, he now works as a general practitioner community doctor. Dr. Cannonier is a vaccine advocate who believes that vaccines are a necessary and integral component of any strong health system. Dr. Cannonier's medical motto, prevention saves lives, time and resources. In his leisure time, Dr. Cannonier enjoys cycling. HealthWise honors Dr. Khalil Cannonier in its Medical Personality Spotlight.
As a Miss Culturama contestant, elegance, sophistication, and independence are highly valued. And you get all of this with the Visa Black Card from National Bank. Enjoy worldwide access to top-notch hotels, vehicle rentals, and unique experiences. The National Bank Visa Black Card makes every day feel like the world is my oyster. Plus, the Visa rewards and exclusive local discounts give me value-added savings and benefits that I enjoy. The National Bank Visa Black Card truly embodies the essence of beauty and excellence. My life, my way.
The Visa Black Card, where beauty meets freedom. Only from National Bank.
Okay, thank you and welcome back to HealthWise. And we have discussed so far for the past 45 minutes or so, postpartum depression, signs and symptoms, those persons who are at risk for postpartum depression. We have had two brave guests in the form of Nordia Demming and nurse Nicole Fredrick. And we want to thank you so much for coming on to share your experience with us. The clip before, I hope you did not miss it, but that was one of our doctors, Dr. Cannonier. One of the objectives of this show is to put spotlight on the many hard-working doctors whose performances most times, their performance, it go unknown. So Dr. Cannonier, he was the personality of this show tonight. And we want to kudos Dr. Cannonier for doing such a great job in the community with his patients. And as we progress with the show, every time we have a show, we would bring one of our doctors who are working tirelessly in this federation. We're going to wrap up shortly because we have rebranded, we have refocused, and our show is now 1 hour instead of an hour and a half. So we're going to wrap up quickly. But before we do so, David, I want you to go to slide 6 for me because I want this out there. I don't think many persons know about this. Sure. In fact, I was, taken off guard when I saw it. So slide 6, and this is a dad, and he is saying, no one has asked him if he is struggling. I was surprised that dads too go through postpartum depression because I was thinking, I am the woman, I went 9 months, I pushed a watermelon through a lime. My body has changed. I am no longer recognizable. And he's speaking about postpartum depression. As we say in St. Kitts, what do he? Okay? So, Dr. Crawford, please help us understand this because I didn't realize dads too go through postpartum depression.
Yes, what persons have to realize is that when there's a baby, the dad has to go through a period of transition from being that single person with maybe less cares, who can go wherever he wants, maybe whenever he wants. So there's a shift in the lifestyle that this dad has. Mm-hmm. Okay, also when there's a baby involved, the attention is not so much on him anymore. The attention is on the baby. And sometimes that can make the dad feel left out because the visitors come to the house to see the baby. Okay? The mom is concentrating on the baby and everything is related to the baby. So the dad is left there feeling, alone or sometimes not so much involved and just a loss of the lifestyle that he had before. Yes. And that is negative events or negative experiences he can have from these changes, and that can cause him to develop depression. So it doesn't mean that he's not happy to be a dad and he didn't want to be a dad, because even in cases when pregnancy is planned, you do have persons, and the dad can develop the postpartum depression also.
Okay, so we are basically out of time. This topic, we can stay here forever and speak about it forever. I'm sorry we didn't get calls in, but notwithstanding that, you can still call the numbers 466-2666 and ask your questions, and the workers at ZIZ, they would get in touch with us, the doctors, and we can actually clarify your questions. So the numbers would be 466-2666, 662-8674, and I think you have them at the bottom of your screen, so you can note them, you can note your questions and call in and leave your questions, and we will surely get back to you. So we're going to wrap up, and I'm going to have my guests give a few seconds of closing remarks, and then we're going to leave you to your night. So Nurse Nicole, we're going to start with you. Nurse Fredrick, we're going to start with you. You have done great. Just your closing remarks.
I just want to tell the public, the general public, to, as Dr. Woodley was mentioning earlier, to be supportive, be empathetic towards, the society, to people who are struggling, who you see. There's always a root cause for something. So I just want to let you know that if you see someone struggling, lend a helping hand. It takes a community to raise children. So, and it would be remiss of me if I came on the show and not mention prayer, being a Christian. Prayer is very, very important. If you can find a church group or a support group that can pray for you, I would encourage that you get someone to assist you in prayer. And don't be afraid to speak out. People don't know if there are problems if you don't speak out in regards to the problem. We cannot help you if we don't know what the problem is.
Thank you, Ms. Fredrick. Dr. Crawford?
I want to tell the public that postpartum depression is real.
Yes.
For both men and women. It is real. Sometimes we look on social media and we see persons making it look so easy and things like that, and sometimes that makes persons feel like they're bad mom or dad because they are not as happy as the influencers and all these other persons on social media are looking. But what I want to say to you, listen, if you're feeling sad and down, if you're feeling like you've lost interest in doing things that you used to do before, you notice there's differences in your sleep or your appetite or your concentration, or you find that you've slowed down a bit, or you're even more agitated. You're having thoughts of, hopelessness and you're indecisive and things like that. And if you're having thoughts about hurting yourself, please, there is help. You don't have to go through this alone. There are support groups. We have the Counseling Center, 465-5000. Persons can contact the Counseling Center and get help. We have several counselors there who are willing to help you. Please reach out. One of the main problems we have is lack of support. And if for some reason you can't find the support in your environment, you can find the support at the health centers, you can find support at the counseling services at JNF Hospital, and you can definitely find support at the counseling center. 465-5000. You don't have to be alone with this.
Thank you so much, Dr. Crawford. Dr. Stones?
Well, thanks very much to the participants this evening. I've learned a lot, and wow, what stories we've heard. Again, I would really encourage people to speak up, and please don't feel that the doctor will think you're stupid or whatever. Sometimes we're not particularly engaging in our manner, but it's okay to break through that. Say, look, I've got a problem. I need your help. And I need some input here, and that's perfectly fine to do that, and I would encourage people to do that. Also, I think the counselling centres have been mentioned. In Nevis, we have a really nice network of health centres, and the health centre nurses are tremendous, and they are very mature, very caring, and I must say, if I had a problem, they would be my first port of call. Because they're full of wisdom there, and they're closely involved in antenatal care and newborn care and looking after mothers after the birth. And I think we haven't again talked so much about the professional services immediately after the birth, and I think that is an area where we perhaps do need to strengthen things. For example, home visits. I think the research shows that that's a very good mechanism for supporting mothers in the first few days and weeks after the birth. And of course, that's the kind of community mechanism that I think there's plenty of scope for us to strengthen.
Okay, so we want to thank everyone for coming here. Nordia, you're off, but we want to thank you as well for coming here and sharing your experiences. We want to thank Nurse Fredrick as well, Dr. Crawford and Dr. Stones. We also want to thank the crew for ZIZ, the new management at ZIZ. We want to thank you for giving us this platform to elevate the medical literacy in our federation. Thank you and be safe. Good night.